Where do all those samples go? What happens when that blood leaves the room? Where does it go? Well, it goes to Dexter's lab, right? I mean, we have this image in the public, and I'm just saying we, like me, the general John Q. public, is it's a dark, kind of keyless room where all these instruments are going, and somehow out of all of this, the result comes back in a piece of paper. And it's a complete disconnect as to who's running the lab, what's happening down there, and what are they doing? Every one of these tubes is a person. And yet we don't think of it that way. If you're seeing thousands and thousands of test tubes running through these things and you're trying to keep control, you're focusing on did we do their test right, what are the results, when we can get it out to them, how do we do it? You know, the day-to-day job. But really, it's going to a real person. Technologists and technicians are already at the bedside with the monitoring devices. They calibrate the different systems, the glucose checks, all that stuff that nurses are doing. But they don't have a face in the room. They have the machine in the room, but they don't have a face in the room. So the idea is to bring the lab into a standard of care that makes it doctor-patient lab versus just doctor-patient relationship. Personal contact goes a long way to making people work better, feel better, committed to their cause. It makes it less of a processing plant and more of a personal concern for individual patients. The proposal that Dr. Corinne is saying, where you have a physician, a nurse, and a lab person show up on the rounds. Maybe the lab person doesn't come every time, but the fact that they could show up and say, "Hi, I'm a laboratorian. I'm doing the test results for you. If you have any questions, this is our number. You can call down." Getting that patient another channel. There should be a doctor-patient lab standard of care, and I think that the lab should be an integral part of that and tied into the medical practices committee more and what each treatment of that patient is going on. And that will also raise, I think, the enthusiasm and energy of the lab, because now the lab is personally involved with these people, and that's why you guys got in this business. I mean, yes, you could be working, at Google, or you could be working on Wall Street, but I gotta believe that a lot of reason why you're in this business is because you care about people and you want to make them better.